The topic of my class today is patient medical adherence and medication adherence. So, in our class, we will discuss about how the patients who we start about taking medication. We are prescribing them medication. They don't adhere to the prescribed medication. The patient come to the our emergency for cardiac attack, MI, for cardiac arrest, for diabetic emergency, for any type of emergency. But after the patient move from our department, then it don't care about the medications. And adherence is measured, and which types of adherence medication and non-adherence are taken into account. So in this slide we can see extent of non-adherence across the population. In the whole of the population which comes to the our emergency, to the OPD, for every 100 prescriptions which are written, only 50 to 70% of the prescriptions are filled by the pharmacy. Okay, the pharmacist only 50 to 70% of the prescription he fills properly. Rest are not filled properly. Then only 48 to 66% of the machines, 48 to 66% of the medications are picked from the pharmacy. Then only 25 to 30% of these medications are taken properly by the patient. Okay. Then after 1 week or 15 days, when the course is over, then you go to OPD, you go to emergency next time. Then only 15 to 20% of the prescriptions or medications are refilled as prescribed. So at any given time, only 50% of the patients are non-adherent. But we often think of medications non-adherence, whereas patient forgets or misses his medications. So adherence is the process by which patients takes the medication as prescribed. So how can you start it? First, we have to initiate the adherence. The initiating adherence means patient does not initiate treatment. Binary yes or no. If patient don't want to take the treatment, there are some patients, old age patients, geriatric patients. Some patients are child who don't like the taste of the medication. Some patients who don't want to see themselves that like they are diseased, so they don't take medication. So we have to first identify such type of patient who take the prescriptions, who take the consultation, but they don't work forward for the medication. Then second one are implementation. The patient delays it, omits it, takes extra doses. It all comes in the dosing history. When we prepare the history of the patient, medication history, we take the history, past history, present history, present history of present illness. So there is a column, there is medication history. So in that medication history, there is a column of dosing history. So patient delays it, persistent, omits it, takes extra dose, etc. Then the third thing comes with time is persistence. Patient discontinues treatment. Okay, let's take an example. I am the patient. I came to your OPD. I came to your emergency. Sir, I am having fever and cough. Cold, cough and fever. So you prescribe me some antibiotic, some more antipyretic medications. Then after 1 or 2 doses or after 1 or 2 days, I get relief. So after I get relief, I stop the medication. I am the patient. I discontinue the treatment. Okay, after 2 or 3 days. But the antibiotic should be taken for 5 days. It has a course, and the antipyretic should be taken for 3 days. Or if we are taking any type of steroids like methylprednisolone 16 mg, so it should be decreased by reducing half amount, 8 mg, then 4 mg, then 2 mg, not suddenly. The patient discontinues the treatment suddenly. Okay, so for the adherence to the is the process by which patient takes the medication as prescribed by the doctor. So now adherence is also linked to clinical outcomes. So this is a chart. It is from the United States of America. The medication non-adherence in the United States costs $100 billion to $300 billion per yearly on their healthcare budget. 33% to 69% of the hospital's admissions are due to non-adherence. The patient start taking the clopidogrel or antiplatelet for his cardiac problems. Then after 1 month or 15 days or 1.5 months, patient says, I am okay. I don't have any chest pain. I should not take these heart medication. But suddenly he got a cardiac arrest. He got a MI, inferior wall MI. Okay. So the patient get hospitalized. due to non-adherence of his antiplatelet drugs or clopidogrel or anti-cardiac drugs. Non-adherence. The doctors advise him to take it for 6 months, 9 months, 12 months, but the patient is not due to non-adherence. The patient get hospitalized. In India, the best case scenario is the patient who are TB patients, tuberculosis, lung tuberculosis. So lung tuberculosis patients, what are they? They are getting cough. So after getting cough for many days, the patient go to the doctor. He's diagnosed for the TB. Patient after taking 15 days or 1 month or 2 month treatment, he stopped the medications of TB. Now the bacteria of TB has not died because the TB regime is minimum for 6 months or 9 months, or for SGR TB is for 12 months. Okay. So after 2 months, the patient, the cough subsided, patient has stopped taking medication. Then that TB became drug resistant TB after few months, after few years or few months. Then patient again came to the OPD for the same complaints. That, sir, I have cough and cold, and I have severe cough for 20 days, 30 days, 40 days, and I have a history of TB few years back, but I have stopped the medication after 2 months. Okay. So good adherence reduces adverse events and mortality. Okay, adherence to the prescribed medication, it reduces adverse events and mortality. This chart is from United States, so you can see easily here, lower adherence associated with greater risk and major adverse cardiac event. Okay, so proportion of days covered, adherence measured with pharmacy refill data. These are time of months, and this is cumulative incidence of incidence of the disease to occur again. So these are the incidents of the disease to occur again, and these are the months of time of months. After 6 months, the patient has stopped the taking medicine. After 12 months, it stopped the taking the medicines.